Now, heart attack is a very common thing, and it is very one of it could be very much disastrous thing. The heart-related pain is usually very commonly seen in those patients who usually have high blood pressure, or who have diabetes mellitus, or who have a history of or habit of smoking or alcoholism, or those patients who have high homocysteine levels, high uric acid levels, or those patients who are purely vegetarian. If the patient has poor sleep habits, if they work a lot, and they take very poor diet, then those patients can also have a heart attack. But most of the patients have either diabetes or hypertension, or smoking or alcohol history. So the typical chest pain related to the heart attack is usually in the center of the chest. It is not very commonly found like in extreme of the left side or extreme of the right side, but it is very typically seen in the center of the chest. It can be behind this chest. It can be heaviness type of chest. So they may think that their chest is being squeezed, or some large stone has been put on the chest. So they may feel difficult to take breathe in. So it can be difficulty in breathing. This type of chest pain can radiate towards the neck. This can radiate to the right side, medial part of the arm, or left side or medial part of the left side of the arm. But this type of pain is very unusual to present in the abdomen. So most of the time it is chest pain. If the patient has diabetes, patient may not have this typical chest pain. So that can be a palpitations, or shortness of breath, or uneasiness, or profound sweating, which we call it as diaphoresis. This type of symptoms may be there if the patient has diabetes, because the nerves giving us the sensation of pain are usually very commonly damaged in diabetic patients. So chest pain, which is central squeezing, heaviness, or burning type of pain, that can present with sweating, uneasiness, palpitation, with shortness of breath, which is usually sudden onset, or that may be lasting from a few minutes to few hours, can be definitely definitely heart attack. And if anyone has diabetes, hypertension, smoking, alcohol, or other risk factors, they should do an ECG done immediately, which is a very cheap investigation. And immediately we can come to know ECG. If it shows MI or heart attack, we can come to know easily. If the chest pain is persistent, if the ECG doesn't show the required changes of heart attack related changes, then at that time we do repeat the ECG, maybe after 30 minutes or 1 hour or 2 hours, depending on the clinical scenario. But heart attack pain or chest pain should not be never be ignored at any cost. Thank you.